After weight loss surgery, Wegovy or Zepbound can help when hunger and portions climb again, but these injections cannot repair a stretched pouch or widened surgical opening. Finding the cause comes first. Surgery reduces stomach capacity and changes hunger signals, but those effects can weaken. The brain raises appetite after weight loss, while a smaller body burns fewer calories. Surgical anatomy can change over time. Not every upward change means the operation failed. Many people regain some weight after reaching their lowest point, and water shifts can move the scale temporarily. A steady rise across months matters more than a fluctuation. Use your lowest stable weight after surgery as the starting point, then compare it with your current trend. Do not compare only with your pre-surgery weight. A persistent rise deserves review when hunger or meal size increases, or when diabetes, fatty liver disease, or sleep apnea worsens. Next, identify what changed before choosing a drug. Constant hunger, fading fullness, larger meals, and frequent thoughts about food suggest appetite has returned. Liquid calories, alcohol, all-day eating, and soft high-calorie foods can pass through easily, even when the surgical structure looks normal. Several medicines can amplify the same pattern. Insulin, some older diabetes medicines, steroids, and certain mood medicines can increase hunger or weight. Stopping them suddenly may be unsafe, but reviewing alternatives can remove an avoidable cause. Weight regain is not always caused by returning appetite. Over time, a gastric sleeve or bypass pouch can stretch, and the opening to the small intestine can widen. This may allow larger meals or make food leave the pouch faster, so fullness fades sooner and calorie intake rises. That can contribute to weight regain. Clearly, larger portions or feeling full for a much shorter time may signal a structural change. New severe reflux, repeated vomiting, trouble swallowing, or abdominal pain also require review by the weight loss surgery team. That evaluation should happen before medication is added. Evaluation may include upper endoscopy, which uses a camera to inspect the sleeve, pouch, and surgical opening. Imaging may also be needed. Some widened openings can be reduced through the scope, while other problems require another operation. After structural causes are ruled out or treated, medication can target regain caused by hunger. Wegovy contains semaglutide and mimics a fullness hormone called GLP-1. Zepbound contains tirzepatide and activates that pathway plus a second hormone signal. Both reduce hunger, make smaller meals more satisfying, and slow stomach emptying. Because they are injected, gastric bypass does not reduce their absorption. Evidence is encouraging, although most studies remain short and use past medical records. In one 6-month study of sleeve surgery patients, semaglutide produced 10.3% average weight loss. Tirzepatide produced 15.5%. Medication may therefore reverse a meaningful share of regained weight. Those numbers do not prove that tirzepatide always works better after surgery. Researchers reviewed past records instead of randomly assigning treatment. The groups may have differed in dose, treatment length, or health. The study included sleeve patients, so those percentages cannot be promised, especially after gastric bypass. Even when medication works, a 12-week course may be too short. The body often pushes weight back up when treatment ends. Surgery does not silence every signal that drives hunger, and medication does not permanently erase those signals. Long-term treatment may be needed when benefits outweigh burdens. Dose increases should reflect side effects and hunger control, not a race toward the maximum. People after sleeve or bypass can dehydrate quickly when nausea, vomiting, or diarrhea limits intake. Delay an increase while vomiting or poor intake continues. Protein and fluid intake become daily safety priorities. Small meals already limit intake after surgery, and stronger appetite suppression can reduce it further. Dark urine, dizziness, very little urine, or inability to keep liquids down require prompt medical advice and may require urgent treatment. Protein intake also needs attention because surgery already limits how much a person can eat. Wegovy or Zepbound may reduce intake even further, making it harder to get enough protein. Over time, inadequate protein can contribute to muscle loss, weakness, and poorer recovery from illness. Resistance exercise and a realistic protein target can help protect strength while weight comes down. Before treatment, review the surgery records, weight history, meal pattern, symptoms, medicines, and blood tests. This can reveal a fixable cause before stronger appetite suppression makes eating harder. It also shows whether vitamin, kidney, liver, or blood sugar problems need attention first. The deciding question is not which injection produces the largest average weight loss percentage. It is whether regain comes mainly from returning appetite, a structural change, or both. Regain caused mainly by hunger often responds to medication. Structural problems need direct treatment, while mixed cases may require both approaches. Wegovy may fit when insurance coverage, prior response, or side effect tolerance favors semaglutide. Zepbound may fit when greater average weight loss is important, and Tirzepatide remains affordable. Even a stronger drug cannot help long-term if cost or side effects force treatment to stop. A previous bad reaction can guide the choice. The operation changes the monitoring plan. After sleeve surgery, reflux, vomiting, and the ability to eat deserve particular attention. After gastric bypass, deficiencies involving iron, vitamin B12, folate, calcium, and vitamin D are common. Stronger appetite suppression can worsen an existing nutrition problem. Blood tests should match the operation, symptoms, and previous results, rather than one identical checklist for everyone. Common checks include blood count, iron stores, vitamin B12, folate, vitamin D, calcium, kidney function, and liver tests. Diabetes medicines may need adjustment as blood sugar falls. Standard warnings still apply after surgery. Severe abdominal pain may signal inflammation of the pancreas or gallbladder disease and requires prompt review. Do not use these drugs during pregnancy. Stop semaglutide at least 2 months before a planned pregnancy. A personal or family history of medullary thyroid cancer also rules out treatment. So does multiple endocrine neoplasia syndrome type 2, a rare inherited tumor condition. Success should be measured with more than one scale reading. Look for a sustained downward trend, less hunger, smaller portions, adequate fluid and protein, and improving blood sugar or blood pressure. Dramatic early loss followed by repeated vomiting, weakness, or dehydration is not success. An early follow-up should answer 3 questions. Is weight moving down? Is appetite easier to control? Can treatment continue safely? When all 3 answers are yes, continue the agreed plan. Dose changes should follow the prescribed schedule and individual tolerance. If weight remains unchanged despite strong appetite control, revisit eating patterns, medicines, and surgical structure. If side effects dominate, a lower dose may work better than stopping completely. Maximum dose is not the goal. The best long-term dose controls hunger and remains sustainable. Do not wait for regain to erase the entire surgical result. Bring your lowest post-surgery weight, recent trend, hunger changes, meal size, symptoms, and medication list to the visit. Those details help separate returning appetite from a structural problem and shorten the path to treatment. Wegovy or Zepbound can reverse meaningful regain after weight loss surgery, especially when returning appetite is the main driver. They work best after checking the surgical structure, protecting fluids and nutrition, and planning long-term obesity care. The right plan treats the cause, not only the number. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.